For some background and statistics on maternal death rates being higher in Black Americans, we have non-Hispanic Black women are 3 to 4 times more likely to die from pregnancy-related causes than non-Hispanic white women. And this disparity has existed for over a century and it has only increased. Non-Hispanic Black women have had the fastest increase in maternal deaths between 2007 and 2014. A study found that Black women had a 2.4 to 3 times 3 higher case fatality rate than that of white women for 5 complications, which are preeclampsia, eclampsia, abruptio placentae, placentae previa, and postpartum hemorrhage. And the risk of a pregnancy-related death for a Black woman in some areas of the U.S. is similar to the risk for women in some developing countries.
Stakeholders are people who are most concerned with the given issue of higher maternal death rates in Black Americans. And these stakeholders in this issue are OBGYNs, health system administrators, and community-based organizations. The American Journal of Obstetrics and Gynecology conducted interviews with people who hold positions in our stakeholder groups. And there were 3 emerging themes that these people discussed. And the first was that Black women are more stressed than white women, that they receive lower quality of care because they live in low-income areas and also because of implicit racial bias within the healthcare system. And the last one was racially inequitable laws and policies, so systemic and structural racism. So for our first quotation, we have one of the stakeholders saying that lifelong stress, continuous chronic lifelong stress, is an issue that Black women are faced with, and the prenatal care that we provide does not address stress. The next quote is regarding the second emergent theme, the lower quality of care. And the quote discusses a nurse who made assumptions about a patient and rather than educating her, just left it alone. And this is an example of implicit racial bias and an unconscious bias that this nurse may have developed when it came to this patient. And our third emerging theme, racially inequitable laws and policies, we have a quote which states, many of our programs, many of our institutions, many of our policies were rooted back in the Jim Crow era. Most of our policies did not have us Black people in mind. And this person goes on to say that these organizations and institutions need to make sure they account for not only Caucasians, but African Americans, Hispanics, and Asians.
Okay, so I'm going to be discussing how social media and the internet have influenced people's perception regarding this problem. So social media and websites are created to raise awareness for the inequality of healthcare of Black Americans and discuss maternal death rates in Black Americans. Obviously, there's a lot of different social media platforms, but one platform that I found had a lot of different organizations was Twitter. And the Centers for Disease Control and Prevention is a website used that discussed a lot of varying aspects of this problem. So like I said before, I looked into Twitter accounts. This is where influencers and organizations use social media to raise awareness. And a lot of these actually had a strong following. So one account that I found on Twitter is called the Black Maternal Health Caucus. Their bio said that they're a congregational caucus established by Representative Underwood and Adams, used to elevate the Black maternal health crisis and advance policy solutions to save lives. They have quite a following. They had 10,000 followers and work together with the Black Mamas Matter Alliance, which is also a Twitter account. They have 29,000 followers, and their bio stated that they envision a world where Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. These 2 accounts held a virtual rally during Black Maternal Health Week, which occurred on April 11th through the 17th. Here they discussed what roles people can play and how they can help this crisis to slow down. Like I said before, the Centers for Disease Control and Prevention is the website I looked into. Recently, they released an article in the beginning of April that discussed Black Maternal Health Week. Within this article, they talked about how most pregnancy-related deaths are preventable and how Black female Americans are 3 times more likely to die in childbirth than anyone else. And these factors that contribute to this is the quality of healthcare, underlying chronic conditions, structural racism, and implicit bias. They also discussed how we can work together to reduce Black maternal mortality, and they said that they discussed what family members, healthcare providers, hospitals, and communities can do to make sure Black mothers receive equal care. They discussed the different things the CDC is doing to prevent Black maternal mortality. They release in enhancing reviews and surveillance to eliminate maternal mortality. Here, it facilitated an understanding of the drivers of maternal mortality and complications of pregnancy to better prevent maternal deaths and reduce racial disparities. They also released a perinatal quality collaborative, and this is used to improve the quality of care for mothers and their babies. This works to support the capabilities of PQCs to improve the quality of perinatal care in different states. CDC also released a level of care assessment tool. Here it is used to standardize their assessments of levels of maternal and newborn care for delivery hospitals. Lastly, they promoted the Hear Her campaign, which is used to raise awareness of potentially life-threatening warning signs during and after pregnancy and improve communication between patients and their healthcare providers.
So, in a broader context relating to health inequities, disparities, and social justice, factors contributing to maternal health, which also play a role in these, are socioeconomic factors, race and ethnicity, neighborhood factors such as housing, provider factors such as knowledge, implicit bias, and communication to the patients, and system factors, which would be access to high-quality healthcare, structural racism, social and political policies, and healthcare institutions. And some data that was found was a large portion of health disparities in racial and ethnic minorities is due to usage of lower quality hospitals. 75% of Black deliveries in the U.S. occurred in around a quarter of the hospitals, while only 18% of white women delivered in those same hospitals. And these hospitals had higher risk-adjusted severe maternal morbidity rates for Black and white women. The Listening to Mothers 3 survey found that 40% of participants experienced communication issues, and 25% perceived discrimination during birth hospitalization. Black women had some of the lowest rates of first trimester prenatal care, and factors playing into this include insurance status, transportation availability, and other social factors. And lastly, Black or Hispanic race or ethnicity mothers were found to have 3 times higher odds of discrimination due to race, language, or culture.
Moving on to solutions, the CDC is well aware of the issues surrounding the higher maternal death rate in Black Americans. The few implementations they have are as followed. On a state and community level, assess and coordinate delivery hospitals for risk-appropriate care, fit to the Black mother's needs. For health providers, help patients understand the urgent maternal warning signs and when to seek medical attention right away, and manage chronic conditions or conditions that may arise during pregnancy like hypertension, diabetes, or depression. Lastly, in hospital and healthcare systems, identify and address unconscious bias through programs structured at reshaping and improving these factors. Now, one solution we have is a transportation program set up to take women to and from prenatal care visits. This would be specified for areas where Black women face lower rates of prenatal care. Overall, this would increase first trimester care in Black women and improve the health of the mother.
As future healthcare providers, we have the ability to support African American mothers and protect them from any fatal complications. We can be aware of any warning signs, recognize and rid ourselves of unconscious bias, provide respectful, quality care, and provide prenatal care and postpartum care. The CDC is doing its part in preventing maternal mortality. They are supporting states through their Erase Maternal Mortality program, which helps providers understand the drivers of maternal mortality, and it improves care to mothers in all communities. And they also support the Hear Her campaign, which raises awareness of fatal warning signs and improves communication between mothers and their providers. Hopefully, with the assistance of the CDC and the various stakeholders in this issue, we will be able to lower the maternal mortality rate among Black Americans.